Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about how every patient that we see is treated as brain injured until proven innocent. Now, that might be a very strange statement, but I'm going to tell you about that in just a moment. Now, if you're local to us and you want to give us a call to find out how we can help you, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you can fill out a questionnaire and get feedback, or you can schedule a consultation directly with me. Now, let's talk about everyone's treated as brain injured until proven innocent. If we really think about it, there are so many circumstances that we've all probably lived through in our lives. I can honestly tell you about quite a few different head injuries that I've had, unfortunately, and some of them were not that great. I never landed in the hospital for them, thankfully, but let me tell you about a couple. And let's see if this reminds you of something that happened to you. I actually slipped and fell in the bathtub and fell on my tailbone and hit my head on the tub one time. And then last year, actually about a year and a half ago, I fell off of my porch about 5 feet down on, well, maybe 4 feet down onto the ground. And again, hit my tailbone. In that particular case, I really suffered from a whiplash type of situation, and then maybe even like a mild concussion. What was interesting is that right after that, when I got realigned with my chiropractor and I felt better, I rode on my mower to mow my yard, and my yard is like filled with all these molehills and inconsistencies, and it's up and down and you're bumping all over. And the first time I did that, after I got better and back in alignment with my spine, I felt like I went through that trauma all over again. I can also think about times I lifted up, or I got, hit a cabinet with my head, or I got bonked on the back of my head because the hatch of the car came down on me. Do any of those sound familiar? Maybe you fell off of something and you hit your head directly. Maybe you had a car accident and you had a concussion or whiplash, or there can be all kinds of different brain injuries. The thing is that we don't really tend to think about some of the ones that I mentioned as a brain injury. We just think about it like something silly. And for kids, they topple over and fall off of the back of a couch or a chair, or, they're running and smack into something. We don't think anything of that, but those are little things that actually can be kind of like small head injuries. Now let's talk about, do you ever eat foods that you're allergic to and it causes a body reaction for you, like a swollen, bloated tummy? But if that's you. If you've eaten foods or anything like that, maybe you've come into contact with some sort of chemicals or mold in your house. Maybe you've even had something like, gosh, maybe you had Lyme disease. There's so many different things that are neurological insults to our body, which we consider to be small types of traumatic brain injuries. They are neurological events. So see, when you think about it that way, foods you eat, air you breathe, things that you consume via drinking or otherwise, stuff that you're around, there's lots of different things that really coexist or can be called maybe like a traumatic brain injury. Now, what about cases where the person has an eye turn, or they have maybe like amblyopia, or they had a stroke? Obviously, those are all cases too where we consider like something went wrong or haywire within the brain, or you wouldn't have a strabismus, or you wouldn't have an amblyopia, right? And the stroke wouldn't have occurred. So these are all kind of considered brain injuries. Now, what do we do about that? Well, I tell you this because all of our patients are started off with a filter in Syntonix that's considered to be a brain injury filter. Now, I'm going to do my very best in this video just to show you what that might look like. And you can see it actually pretty good. It's this nice dark bluish purple. This is the color that is utilized for treating patients after traumatic brain injury. So we use it for every single patient who becomes a patient in our clinic. It's the very first filter that we utilize, and you may end up using this for 3 to 5 months depending upon the severity of the trauma and how much your brain needs to kind of go through a healing phase. Now, if you want to learn about how we treat patients who had traumatic brain injury, of course, there's several ways you can connect with us. You can go to our website at visionforlifeworks.com. You can fill out a questionnaire. You can schedule a consultation. If you're local, you can give us a call at 618-288-1489. Find out more about how successful our clinic is in helping our patients with all of these problems that I've just mentioned. And as usual, if you like the video, hit the like button, subscribe if you haven't done so already, and pass the video on if you feel it could be helpful for someone. Thank you.